Welcome to Virtual Family Training for Immigrants. The instructors in the Finnish Virtual Family Training are public health nurse Annina Soyrjö and peer instructor Lama from Syria. This virtual family training is part of the peer-based family training model for immigrants of the NITU project, which is coordinated by the Tampere University of Applied Sciences with the city of Tampere acting as its partner. The project is funded by the Asylum, Migration and Integration Fund, AMIF. It will run from 2018 to 2020. This section of the family training deals with breastfeeding. We hope it will provide you with useful information on your journey towards the birth and your everyday life with your baby. Breastfeeding is the number one recommended way to feed a baby. Breastfeeding provides many advantages for both the mother and the baby. Breastfeeding helps the mother to recover from the pregnancy and labor and reduces her stress. It also reduces the mother's risk of contracting several diseases at a later date, such as diabetes. For the baby, breast milk is the best source of nutrition. It contains all the nutrients the baby needs, apart from vitamin D. It contains a lot of substances that strengthen the baby's immune defenses, which is why it protects the baby against infections. Breastfeeding also has long-term effects on a child's health. It reduces the risk of excess weight, allergies, asthma, and diabetes. Breast milk is free. You always carry it with you, and it's always just the right temperature, which is why it's an easy way to feed your baby. In Finland, exclusive breastfeeding is recommended until the age of 4 to 6 months. Exclusive breastfeeding means that the child is only fed breast milk and vitamin D drops. Partial breastfeeding is recommended until the age of 1 year at least, and longer if the family chooses. Partial breastfeeding means that in addition to breast milk, a child is given formula or solid food. All babies need solid food at the latest by the age of 6 months. From then onwards, all children are partially breastfed. Starting at 2 weeks old, your baby will need vitamin D drops. You will be given advice on vitamin D at the maternity or child health clinic. You will breastfeed your baby for the first time in a delivery room soon after giving birth. If the baby is doing fine, he or she will be put on the mother's breast for skin-to-skin contact. The child won't be washed or dressed before this. In the first few days, you will only have a small amount of breast milk. However, these small drops of first milk, known as colostrum, are very important for the baby as they contain a lot of substances that strengthen the baby's immune defenses. Even if you feel that there's no milk coming from your breasts at all, let your baby suck your breasts as much as they want. The following sentences are peer instructors' personal experience. The first breastfeeding will take place already in the delivery room. It's wonderful how a baby knows how to suckle immediately after birth. The midwife will help you find a suitable position for breastfeeding. Breastfeeding is a new experience for the mother and the baby, and sometimes it's easy and other times not. Either way, we recommend you try to breastfeed as much as possible. We recommend you keep your baby in close skin-to-skin contact as much as possible after the birth. Skin-to-skin contact means that the baby is placed on the mother or father's chest, wearing only a nappy skin-to-skin. When in skin-to-skin contact, the baby is inside the parent's shirt or the baby's body is covered with a blanket. The baby's head should not be covered, and it's important that the parent is able to see the baby's face. Skin-to-skin contact has a lot of advantages. It helps the baby to adjust to life outside the womb and also helps the milk to come into the breast. Breastfeeding is done on demand when the baby wants it. Breastfeed whenever the baby shows willing. You should feed the baby at least 8 to 12 times a day. During the first few days, the baby will want the breast frequently, which will help the milk to come in. During the first few days, one breastfeeding session may take up to an hour, but the duration will shorten considerably over the first few weeks. The baby will express hunger in several ways, and crying will be last sign of hunger. First, the baby will lick and smack their lips. The baby will begin to turn his or her head and fumble for the breast with their mouth. Sucking a fist is another indication of hunger. Parents often learn the baby's signs of hunger quickly. The baby won't need a dummy during the first few weeks, as it may interfere with breastfeeding. Let the baby suckle your breast every time they seem keen. Often the milk will come into the breasts properly within 2 to 4 days of the birth. By then, many families have already returned home from the hospital. At home, it's a good idea to still keep the baby close and skin to skin a lot of the time. It's best to let the baby have the breast as often as possible. The more the baby suckles the breast, the more milk there will be. The mother should eat, drink, and rest enough. A relaxed, positive mood will help with the breastfeeding. A good breastfeeding position is one where the baby can get a good grip of the breast and the mother feels comfortable and relaxed. In a good breastfeeding position, the mother and the baby's belly buttons are facing each other so that the baby doesn't have to turn his or her head to suckle. You are in a good breastfeeding position when your nipple is level with the baby's nose. This allows the baby to tip their head back, open their mouth wide, and take a good wide grip. It's a good idea to try different breastfeeding positions at home to find the ones that best suit you. You can breastfeed sitting down or lying on your side or on your back. You can also hold the baby under your armpit when breastfeeding. The strongest suckling motion will occur in the baby's shin. If there's a spot where your breast feels hard, it's a good idea to turn the baby so that their shin is facing the hard area. You can use pillows or cushions to make the position more comfortable. For successful breastfeeding, it's very important to make sure that the baby has a good latch on your breast. When the baby has a good latch, they will suckle more effectively and breastfeeding won't hurt. During the first few days, your breasts may feel sore because they are still getting used to breastfeeding. After that, breastfeeding shouldn't hurt. The baby has a good latch on your breast when they open their mouth wide to take a big mouthful of breast and the nipple is deep in their mouth. The baby's head is slightly tipped back. Often the head is in a suitable position when the baby's chin touches the breast. When the baby has a good latch, you can see and hear them swallow. Don't hesitate to ask the midwife and nurse for help finding a suitable breastfeeding position and achieving a good latch. Often, parents worry that there isn't enough breast milk to feed a baby. If you're worried, you should look out for signs that show your baby is getting enough milk. The most important thing is for the baby to gain enough weight. The baby's weight gain is monitored carefully at the maternity and child health clinic in the early stages. There should also be at least 5 wet nappies a day. The baby should eat effectively at least 8 to 12 times a day, And between breastfeeding, the baby should be content and sleep peacefully for 2 to 3 hours at a time. It's important to remember that the baby's tummy is very small after birth and grows gradually. There isn't room for a lot of milk in a newborn's tummy all at once. On the first day, the baby's tummy is about the size of a grape. On the second day, about the size of a strawberry. At 1 week old, a plum. And at 1 month, the size of an egg. All babies lose some weight during the first few days, and that's normal. During pregnancy, the baby has gained some reserve nutrition that will often help them through the first few days where there's not much milk yet. If the baby's weight drops too much, you will be instructed on how to feed a baby additional milk. If there are signs that your baby is not getting enough milk, you should give him or her additional milk in addition to breastfeeding. Talk to the nurse at your maternity or child health clinic before starting your baby on additional milk. There are different ways to give a baby additional milk. Primarily, the mother's own expressed milk is used as additional milk. If the mother has a low milk supply or doesn't want to breastfeed, formula can be used. A newborn baby can be fed additional milk by letting them sip it from a small cup. Hold the baby upright. Do not pour the milk into the baby's mouth. Instead, offer it from the edge of the cup so that the baby can lick it from there. Small amounts of additional milk can also be fed with a spoon or a clean oral medicine syringe. During the first few days, it's best to avoid baby bottles because the baby doesn't have to work as hard to get milk out of a bottle and maybe become used to a bottle and refuse the breast. If the baby begins to have a larger amount of additional milk later, you can use a bottle then. Breastfeeding isn't always easy. Over the first few days, breastfeeding may hurt a little because your breasts aren't used to it. After the first week, breastfeeding shouldn't hurt. If it hurts, check the breastfeeding position and that the baby is latched correctly. Often the pain is due to an incorrect latch. Often, even a small adjustment helps with the pain, and the best place to ask for help with this is the maternity or child health clinic. When the milk comes in, your breasts often feel sore and hot. A cold cabbage leaf or towel may help you with the pain and swelling. If the problem is not enough milk, it's a good idea to shower your breasts with warm water. Breastfeeding may also hurt if you have a cut on your nipple. It's important to keep the cut clean. At the end of breastfeeding, squeeze a drop of milk onto the nipple to protect it. In the maternity pack, there is a tube of lanolin cream that you can apply on the nipple. You can also keep a gauze square damped with a salt solution on your nipple to help keep it damp. This will prevent a scab from forming on the cut, which may tear when breastfeeding, causing pain. If the cut on your nipple is difficult and won't heal, a nipple shield may help when used temporarily to ease the pain when breastfeeding. Breasts may also become infected. The symptoms of breast infections, also known as mastitis, are a hot, swollen, tender breast and a fever. The primary treatment is to empty the breast carefully by breastfeeding or expressing milk. If there's no milk coming from the nipple, shower your breasts with warm water and massage them tenderly. If the symptoms persist and the fever doesn't fall in a day, call the maternity or child health clinic or doctor. Breast milk is the best source of nutrition for your baby. To begin with, breastfeeding may be challenging, but it's worth working at it. In the end, it's the easiest way to feed a baby. If you don't succeed at breastfeeding, formulas are also a good source of nutrition for a baby. If you have any question about the topics discussed here, please talk to your public health nurse at the maternity or child health clinic. We recommend you also see the other videos and brochures produced within the Need to project. Some of the videos are available with Finnish, Arabic, English, Persian, and Somali subtitles. Some of the brochures have been translated into Finnish, Arabic, English, Persian, and Somali. The employees of the Need to Project wish you a happy pregnancy and all the best with your delivery.